So then now we have the bones of the pelvis. We have this one here again. Sacrum. It's called the innominate or the os pelvis. So you have the ilium, ischium, and the pubis. So then the joints we have is what's here? Yeah, what's about there? Sacrooccipital joint. Sometimes you can have problems there. People will fall, twist their tailbone around, things like that. And then here, this is the hip. We'll be talking about that later. Stay tuned. And then here, we'll go into a little more detail in this here. So the anterior motor unit, what do we have in that comprises the anterior motor unit? Right. I mean, it's right there, so you guys can read it instead of me standing here reading it. Right? And then, we're following one of the notes here. Let me go to over there. So, which part of these supports most of the weight? Right. So 70%. Okay. And then that leaves how much for the back part? And now, when we're doing these different special tests, you want to keep in mind as you bend forward what's happening with the disc. When you bend back, what's happening? Which tissues are getting pressure put on them? So, in a general sense, when we talk about flexion, what's happening there? What's happening here at the disc?
Moving the disc anterior, not posterior.
The other posterior. So it moves it back posteriorly, so then that's going to put pressure on what? Either nerve roots or the spinal cord itself. And then, as we bend back, what happens there? Okay, so the disc moves anteriorly. Is that really going to cause problems? If the disc does herniate anteriorly, is there anything in there? Did that tape run out?
Almost.
Okay, so did you find another one to? I think any of those are okay. Here's that one next. So this, basically we're talking about the whole thing as the motor unit or the functional motor unit, and it's divided into inert things, just the solid bones, versus things that are movable, which is the disc and the facet joints and the facet capsules. Now, this posterior element, the disc itself can pretty much move every which way, right? But it's the facet joints that dictate the range of motion. That's primarily flexion extension. You do have some lateral flexion and rotation. So now the actual vertebra itself, you have what we call the end plates. And this is a flat surface. Now in the lumbar spine surrounding here protects the spinal cord. And so then, like I say, the transverse process and the spinous process are muscular attachments. You do have other smaller processes in there, but we won't get into that. You have mammillary and articular processes, things like that. And then again, here now we're talking about the facet joints, and what part of the motor unit are they? Posterior. And then how do they get affected? By extension. Okay. Now, we'll get into more of this detail. So you can see that we can pass that box around. If you haven't seen these vertebral bones, you can look at some of the facets. And we'll start these around on the other side. So now in the cervical, the facets were kind of a simple flat shape right here, and they kind of go in this plane right here. Then when we got into the thoracic, they're more like this. In the lumbar, they're kind of a curved shape like that. So you can see that the axis of rotation is going to be right there in the center. So they sit like this. So the surface combined like that. Okay? So when it rotates, they move this way. Right? So that puts the center of the rotation at the base of this spinous process. So again, like I say, when that rotates, what happens at the disc?
Shear.
It's sheared. So here, this shows the facets in kind of more in a vertical shape. So it's going to allow some lateral flexion, some rotation, but mostly it's going to be flexion extension. All right, so now let's get into a little more detail on the facet joints. Again, they're true synovial joints. So what does that mean? They have a cartilage surface, they have a joint capsule that goes around. And then they can become pinch and extension. And then they can almost kind of have like a, when we talk about the knee, have kind of like a meniscus or something that, like the capsule can get a fold of it, can get stuck into the joint. So you can have a lot of facet joint problems. And then here, when the facet joints move, when they flex forward, what happens to the joint? Do they compress on each other or do they stretch? When you bend forward. Yeah, so you're opening the facet joints and you're more or less compressing the disc. Right? That's going to limit rotation. So then here's the facet joint here. And then this is what we mentioned before, the pars. And we'll talk more specifically about that when we talk about spondylolisthesis. Now the disc is going to be about 25% of the height of the spine. And then here, what's this middle part? And then you have the annulus fibrosus. So again, the function of it is a shock absorber, and it allows movement. And then it also holds the vertebrae together. There's these little fibers in there called the Sharpie's fibers. So when that's passing around, remember, we're going to talk more about congenital problems, but on the one piece that has the sacrum and the lower lumbar, that's where you're going to find a deformity in there if you look. Oh, the other thing is, when are you your tallest? Like right now, early in the day or later on in the day? Yeah, because what happens at night? Your discs reabsorb the water and they get pumped up. Then as your bones get more mileage on them, they lose the ability to absorb water. So the discs are going to be shrunk more as you get more mileage on your bones. All right, so here you have the annulus fibrosus, and then you can see the way that the fibers are on each layer is perpendicular to the other. So you have the concentric rings, and they arrange in opposite directions. So their job is to contain the annulus fibrosus. I mean, the nucleus pulposus. And so then the nucleus pulposus is this gelatinous material on the inside. It holds more water as you're younger. It's about 85% water. And then over time they dehydrate. It's like when you're younger, your nucleus pulposus starts out like a grape. What happens to grapes when they get all shriveled up and dried up? They turn into what? Raisins. So, later on your disc's going to turn into raisins. But if you do things to try to prevent that, you'll be better off.